Back to school is in full swing, and that means our kids are spreading germs and viruses left and right. During the week of August 11th, Children's Health says 137 COVID cases and 219 rhinovirus cases system-wide. They also expect those numbers to increase. Dr. Megan Kidd is an infectious disease specialist at Children's Health. She's joining us now. Megan, thank you so much.
Yeah, thank you for having me.
All right, what are the most common illnesses among students in those first few weeks of school?
Yeah, so you basically nailed it right now. We're all getting back together and it's exciting to get everyone and start the new year. But with that comes sharing of germs. And most commonly, what we see are viruses. You can get fever, cough, congestion, sometimes vomiting and diarrhea. And unfortunately, except for COVID and flu, we really don't have good antiviral medicines. So making sure your child's drinking plenty of fluids, taking ibuprofen, Tylenol for fever, and then getting plenty of rest.
What's the best way to differentiate between the two viruses you just mentioned, COVID and the flu?
Yeah, that's a great question. So they have very similar symptoms. Both can have fevers, headaches, body aches, congestion, but the most thing that we can look at is the season. So flu, especially in Texas, really starts late fall. So that's the end of October, and it lasts all the way through the spring. So right now, what we're really seeing is COVID and other viruses.
Dr. Kidd, the FDA recently updated plans for a new COVID-19 vaccine. How will that impact children?
Yeah, so it's really exciting. We have an updated vaccine finally. And really, we can think of this as like the flu vaccine. We update the flu vaccine every year to mimic the variants that might be circulating. So these new COVID vaccines have a component against the KP2.2 variant. And what that is a variant that was circulating earlier in the year, but provides great cross protection against the variants that are circulating now. And so we are currently seeing a lot of COVID cases. And so we're recommending as soon as those vaccines are available at your pharmacy or pediatrician, that you guys go ahead and get those vaccines. They have the very similar safety profile. We've now vaccinated hundreds of millions of people. And so we know that these vaccines are safe.
Is there a timeline for that to go ahead and be released and available so just parents can be on the lookout?
Yeah, so it really should be any time now that the FDA has approved it. They should be rolling out, in the next couple weeks.
There's also, Dr. Kidd, a lot of concern about just the germs spreading in school, right? I know you talked about kids drinking lots of fluids, but what are some of those things that we need to be reinforcing for them, whether that's hand washing, things they need to be doing at recess and during playtime, just so we can support healthy habits?
Right. Yeah. So, we're all back together. I know we all still have some COVID fatigue and from the prior isolation practices, but the most important thing, like you mentioned, is hand washing. So especially if you're sick, if your child's touching their face, touching their noses, making sure that they wash their hands frequently. And then those who are not sick, also washing their hands in case they come in contact with those who are sick around them.
Dr. Megan Kidd with Children's Health, an infectious disease professional. We so appreciate you coming in and giving us your insight.
Yeah, thank you. Thanks for having me.